Welcome back to Straight Talk. I'm Laurel Porter. You probably have your ballot for the special election on January 23rd. I got mine this week, so if you haven't gotten it, you should get it soon. We're voting on Measure 101, and once again, the measure asks if we should keep or throw out a new health care tax. If passed, the law would temporarily tax some hospitals, insurance companies, and a few others to make up for a Medicaid funding shortfall. Now, some call it a provider tax, others an assessment, and it means several healthcare providers and organizations will pay a little extra for the next 2 years to keep low-income Oregonians insured. A yes vote means you want the law to take effect. A no vote means you don't. We're looking at the arguments for and against with my guest, Republican Representative Julie Parrish, who led the campaign to put the question before voters, and Felisa Hagins, who works for SEIU Local 49. She supports the measure. Once again, thank you both for being here.
Thank you.
I mentioned in the first segment that we had an editorial. We had one from the Portland Tribune supporting the measure. Now we'll talk about the Oregonians editorial board urging a no vote. They say the tax provisions or assessments are unfair. Here's part of what they said. The problem is they failed the fairness part of the challenge. Instead of treating Medicaid as the shared responsibility that it is, Oregon's elected leaders adopted a funding strategy that includes a tax on premiums for health care plans bought by small businesses, K-12 school districts, nonprofits, and even thousands of college students, about 1.25 million Oregonians in all. The 1.5% tax, however, will not be assessed on health care plans for 727,000 people enrolled through their self-insured employers, nor on hundreds of thousands of seniors and veterans enrolled in Medicare or plans for veterans due to federal restrictions on such state-imposed taxes. The Oregonian editorial board goes on to say Oregonians should stand against the inequity of the tax and demand lawmakers find a fairer way to meet the Medicaid obligation. Felisa, is there a more fair way to fund Medicaid? Lawmakers knew about this since 2014, that the state was going to have to shoulder a bigger burden of the expanded Medicaid under the Affordable Care Act, so they had a few years to plan. Was there a better way?
No, I actually think that this is one of the best ways to fund healthcare. Frankly, it lets the healthcare industry come to the table, which they've voluntarily done. They are paying an assessment, the 1.5% as you talked about, and the 0.7 is what's preferred, but it's a 6% on large health systems. The Oregonian also mentioned that they do believe that if a different way isn't found, that people will be cut off the Oregon health plan. And so we have a solution right now, right? We have a solution that keeps 350,000 Oregonians on the Oregon health plan right now. Now, we cannot, as they pointed out in their editorial, it is clear that it is illegal for us to tax TRICARE, which is Veterans Health Insurance. It is illegal for us to put an assessment on Medicare. And so this assessment is as broad-based as federal law allows.
Representative Parrish?
I'm going to dispute that. So while the 1.5% tax that insurance companies can pass on to ratepayers certainly does not hit TRICARE, I actually have TRICARE. So when my husband, who is a Iraq veteran, goes to a regular hospital like Providence, who says they're going to pay the lion's share of this, $28 million, Providence is going to pass that off to my family in the form of higher hospital costs, because TRICARE does not pick up the tab for everything when you go to a hospital. So seniors who have Medicare, if you have hospital co-pays that go with that, they will see that in the form of a higher hospital service cost. So I absolutely dispute that. And those large corporations and insurance companies and those self-insured plans, the United States Supreme Court ruled that they can be taxed for Medicaid. And when the United States Supreme Court failed to certify that case and they said, we're not going to take that case, it effectively made it kind of a law of the land, a de facto law of the land, unless another court challenges it and it gets run up to the Supreme Court.
Did you want to quickly respond?
I think that there are hundreds of other cases that have gone before the Supreme Court that have had the exact opposite ruling. The court chose not to take it up again because they believe that they've already spoken on the issue,
which is specifically for Medicaid taxation.
They've spoken on the issue, which is you're not allowed to do the assessment.
We'll have to agree to disagree on that
Yes.
one. If this fails, it will go back to the legislature, and the legislature begins meeting in early February. Representative Newt Buehler, who's a Republican candidate for governor, was on Straight Talk last month, and I asked him, could he guarantee people wouldn't lose coverage? And he said, yes, they would not lose coverage, and he said there are plenty of options to fill the funding gap. Let's listen to what he said.
We have alternatives. You remember the revenue projections just came in. They're up $50 million for this biennium. We can increase the cigarette tax. We can add a new vape tax. There's plenty of ways to fill the leftover portion, which is probably only about $150 to $200 million. We can fill that hole. Everyone will be covered in the Medicaid.
You think you can do that in a short session that you weren't able to do in the long session?
Absolutely, yeah.
Well, we only have about 40 seconds to argue this point, but
Sure.
do you think that you can come up with a solution that quickly?
Oh, absolutely. Those bills are already drafted. They're ready to go. They were drafted in 2017. They got ignored. And of course, the legislature is considering a $1.4 billion carbon tax in the short session. So I think we should probably prioritize the programs we actually have first, which includes Medicaid.
Lisa, you want to comment?
What I would say is we have two industries, the insurance industry and the health systems, hospitals, who have stepped up and said proactively, yes, we want to pay these assessments to keep people on Medicaid. I don't think Philip Morris has stepped up to the plate yet to say we want to pay additional cigarette taxes. And so I feel like we have a solution right now, a solution that has broad-based support, that guarantees that 350,000 people in Oregon get to keep their health care, including kids.
I can give you about 30 seconds to kind of wrap it up before we have to go, and why people should vote yes on 101.
I think that Oregonians have strong values. We know that every Oregonian deserves health care. We know that every Oregon child deserves health care. And Measure 101 is a guarantee to make sure that happens. A yes vote on Measure 101, if you read your ballot statement, as you have in your hand, Laurel, says, yes, we agree, Oregonians deserve health care. And it's why we have trusted organizations like AARP, the Oregon Medical Association, nurses, children's groups, labor unions, a broad coalition supporting this measure. And we hope people come out January 23rd, they vote yes, they also come and join us, come canvass with us.
Representative Parrish, you have about 30 seconds.
So yes, thank you. The question voters should ask is not whether we fund Medicaid, but did the legislature fund it fairly? Was it equitable? Is it sustainable? Did the right people, the people who are paying full freight for their own health insurance, are they the people we should tax? We're urging a no vote because the 90,000 Oregonians who signed a petition don't have a lobbyist. They can't write big campaign checks like SEIU is putting into this race. When was the last time you saw a hospital or an insurance company begging you to tax them? Those same hospitals and insurance companies opposed Measure 97, and now they say yes to a healthcare tax. It's because they can pass the tax on to you and me, and they will not have to pay it. And in fact, the insurance companies got a really sweetheart deal in the measure that says they can pass that on.
Representative Parrish, Felisa Hagins, thank you for joining us here on Straight Talk. We want to remind you, ballots have been mailed out for the special election. They're due back at 8 o'clock, by 8 o'clock on Tuesday, January 23rd. We'll post this show on kgw.com if you missed any part of it. And we'll see you next week for Straight Talk. Have a great week.